Welcome, and thank you for participating in the 2020 Virtual PSW Educational Conference offering. We are grateful for everyone's support and efforts to adapt this year's conference into a digital format that will be shared with pharmacists, pharmacy technicians, and student pharmacists across Wisconsin. To record your attendance for this presentation, you must watch the recording and enter the CE code given during the presentation. All videos will be available in the continuing education platform. After watching the videos, you will enter the CE code provided to you during the session in order to record attendance and claim your CE. You may choose as many sessions as you are interested in. In order to get back into the virtual conference, please make sure to save the original sign-up email from the Lecture Panda system. This link is the only way to get back into the course. You do not need to complete everything at once, and your progress will be saved until the next time you log in. CE will be reported directly into the CPE Monitor portal. PSW recommends that all pharmacists and technicians should regularly review their CPE Monitor portal for accuracy. If you cannot find your original email, please email info@pswi.org to have your individualized link sent to you.
Welcome to Self-Care in Healthcare, focusing on well-being for providers as part of the virtual PSW 2020 Educational Conference. When we set out to plan this particular session, the leadership of the PSW Educational Programming Committee met and discussed with our keynote speaker how to deliver a highly interactive session live at the Monona Terrace as part of the conference. While we aren't able to be together live in person, we wanted to be sure to bring some of this content in a revised format to you virtually. Now more than ever, well-being, safety, and health is at the forefront of our thoughts and plans. So we will spend today's session talking about provider well-being in the context of the COVID-19 pandemic. Joining me this morning is Dr. Zin Ruppel. Zin is a super PSW volunteer, serving as the chair of the PSW Educational Programming Committee. She is a past member of the PSW Board of Directors and is currently working to lead a work group on diversity and inclusion for PSW. Zin is a board-certified pharmacist and experienced clinician, currently serving as the pharmacy manager of the Family Health Center of Marshfield. Zin, at this time, I'll hand things over to you to introduce our keynote and guest speaker.
Thank you, Sarah. It is my honor and pleasure to introduce to you Dr. Mike Schulein. Dr. Schulein is a health service psychologist in the Marshfield Clinic Health System. And for this introduction, he asked that I note that his commitment to lifelong learning and lifelong caring. In his 31 years at Marshfield Clinic, he has been learning and caring for his patients in both outpatient and inpatient services. He has been learning and caring for medical residents and fellows as the chairperson of the Marshfield Clinic Resident Wellbeing Committee, and he has been learning and caring for Marshfield's teaching faculty as the faculty development lead for the system. He has been learning and caring for all Marshfield providers in response to unexpected staff deaths in his role as chairperson of the system's Crisis Response Postvention Committee. And in the last 3 weeks, he has been intensely learning and caring as a member of the MCHS COVID Response Work Group to develop resources and services to support the staff before, during, and after the pandemic. Dr. Schulein has professional and personal connections to the pharmacy profession and was delighted to accept our invitation to share his learning and caring with us today as we all deal with the challenges of well-being during this pandemic. So without further ado, please welcome Dr. Schulein.
Thank you, and I'm glad to be talking with you all today.
We're so glad to have you. I just wanted to share, for the purposes of this being a CE presentation, that we have no disclosures to report. Our learning objectives for today's presentation and discussion are listed on this slide. We're going to talk about provider self-care and its context related to patient safety, and in this new world we're in related to the COVID-19 pandemic. We also hope to provide you some resources that you can take back to your practices. We're going to keep today's session very conversational. As I mentioned, we're adapting this session from the live interactive version to something virtually today. So I have some questions that I'll share with Zin and Dr. Schulein, and we can have a conversation about this important topic. So first, Dr. Schulein, I'll send this question your way. Why are we seeing such a focus on provider self-care? What is the importance of this topic?
I'm going to use the term BC, which means before COVID. And in the BC world, we were increasingly aware of the direct linkage between provider well-being and patient safety. That's no longer a discussion of if there's a link. The research data now shows us the pathways and some of the places where patient safety is most vulnerable when provider well-being is compromised. And specific to the profession of pharmacy, we see in the research some of the critical items have to do with medication errors related to provider well-being and a higher risk of errors, including errors, missing interactions, missing scripting errors, missing medication reconciliation issues, missing critical labs that would inform prescribing and regimens. That data is established, and that was BC, before COVID. Now, when we move into a time of extreme stress and distress, the issue of provider well-being and the threats to that, and then the linkage to patient safety become even more dramatic. To give you some context, a friend of mine in the Marshfield Clinic Health System, who is an infectious disease physician specialist, at the beginning of this, I asked for her advice on how to support our residents. And her response really surprised me. She said, Mike, tell the residents to do two things. First, tell them to breathe. And she explained that they're going to need to be able to step back during the day and just breathe because of the intensity of the work and the acuity of the work. And second, she said, tell them to keep a diary. And I have to admit that kind of confused me. And what she explained from an infectious disease specialist, was that this pandemic will be a once in a lifetime shared distress event for all healthcare providers. And I want to say that again. This particular pandemic will be a once in a career shared distress event for all healthcare providers. There will be more pandemics, but what she was pointing out was, with this particular pandemic, it's highly likely that in people moving into their careers now, they will never encounter this level of lack of preparedness by our country or our healthcare systems again. And it's that level of unpreparedness that adds another dimension to the distress. Because, and I'm assuming many of your listeners have been part of that in systems where they've been participating in how do they create the policies, the protocols, the algorithms for what's coming, because they didn't have it just at hand and ready to pull up. That adds a whole nother level of distress of not having that set up before we get started. So with that, that's to me is particular for our doing this conversation today.
I think that's so well stated, that shared distress event just hit the nail on the head for me. I've often described the last 3 weeks here as really drinking out of a fire hose, and things coming at you from all directions. We talk a lot about the intensity of things happening in the workplace. I'm interested in both of your thoughts related to the intensity of how this is not only impacting our workplace life, but also all the other aspects of life, and how that factors into that shared distress event.
For me, with that, it's that element of how it is simultaneously impacting our professional lives and our personal lives. The particulars of this, and I'm a psychologist, not a physician, so I want to be careful, but there's a level of uncertainty with this. And then as a result of that shared experience of vulnerability and risk to our families, as well as to our own health, that co-occurs with the stresses of what we need to do in our professions. That combination is particularly telling. In essence, we know that one of the things that helps us manage stress is if we have at least one safe place to go. And the specifics of this pandemic challenge that sense of having one safe place.
And I would agree with that. In addition, I think for our practice, you layer on the information change and how information is developing very rapidly, and sometimes advice can be conflicting. And so to keep up to date to that for ourselves, and then trying to give the best advice for our patients, it is a lot. We like to be prepared, and I would agree with Dr. Schulein that we definitely, as a country and multiple healthcare systems, we're not prepared for the range and the level of response that was required. And so we try and focus on just breathing and keeping things to one day at a time, and just trying to control what we can, but managing what we cannot, and our feelings towards what we cannot control, and trying to take care of ourselves first before, check your own pulse before you check everyone else's pulse too.
Dr. Schulein, I'd love for you to share a little bit about the role that you're playing within your systems response team and the staff supports, and certainly you mentioned learner support in this, again, sort of context of COVID-19 situation and the intensity of that over the last 3 weeks.
Be happy to. Like healthcare systems around the country, we weren't prepared. We didn't have well-developed resources, go-to resources to package in an efficient way to support our staff. And an amazing process unfolded here that I think is paralleled around the country, of people coming together and doing the work in a very collaborative, intense way to identify what the common needs were going to be, learning from those who unfortunately were a step ahead of us with this pandemic, and adapting that to our specific system, developing those core knowledge hubs, and then organizing that in a way where we can make it directly engageable for our staff, all of our staff, whether they have patient-facing or not interactions, and how they support us. Then developing an on-call resource to our staff as well. That was going on as well as our leadership was then looking at the day-to-day fluctuations and issues regarding PPEs, shortages, management, ventilators, all of those. We are now at a point of having developed our structure, putting it together for easy access through our clinic's intranet, to now rolling it out and getting our staff into those roles. So for example, behavioral health, employee wellness are taking a big lead in supporting our staff as we prepare for the surge.
You mentioned the use of PPE, and certainly that's been a topic that's been talked about a lot on Facebook and other news stories, et cetera, the shortage of PPE and that feeling of vulnerability that factors into this situation, the fact that there are healthcare providers that are dying from COVID-19. Can you talk about how that impacts the well-being of providers related to, those two sort of critical elements of being perceived lack of protection and in often cases true lack of protection, and this vulnerability that the healthcare team has?
Sure, and that is it's complex. There's so many places it interacts in both our professional and personal lives. Our exposure in our professional life, and then our uncertainty about our own health as a result, and then our exposure in our personal life with asymptomatic carrier kinds of issues, and are we then a risk to our families, and what is prudent care for all of this when we know the knowledge is evolving very quickly on what's prudent care. That level of uncertainty increases our sense of vulnerability because we have less sense of control. And when we've experienced a diminished sense of control, we're more vulnerable to work from our emotional minds rather than from a wise mind. Unfortunately, the ease of media exposure to what's going on with the pandemic also can fire up our emotional mind, and that intensifies our distress. As a result, I think a shared experience you probably all had is what's happened in our emails and our listservs. We are barraged by information about the pandemic in our emails, and it can, if we start our day looking at all that email, it sets us off at a higher stress level. We'll be barraged in our social media engagement and what kind of news we follow. And I think it's important as a basic self-care tool is to know your own proper dosage of exposure to all of those kinds of inputs about the pandemic to reduce how charged up your own emotional mind becomes, so that you can then use the tools that are available, and some of which I know we'll be talking about in a little bit, to manage the best you can, both professionally and personally.
How appropriate to use the term know your dose for a group of pharmacists. I think that, to me, really, I sort of had an aha moment when you said that. And so let's move towards that conversation about considerations and available tools. Do you want to talk about any of the considerations that we have on the slide here, Dr. Schulein, and maybe share with us some takeaways that we can use? I'm particularly interested in the comment you just made about starting our day, and that then tying to that knowing your dose concept. This is an area that I certainly need to work on, is how I start my day and what that does to set the tone for this day of truly just intense, regardless of whether it's personal or professional life.
I'd be happy to, and I'll work my way down the slide. And I will warn listeners, these are things I'm passionate about, and I tend to get a bit wordy, but Sarah, please feel free to interrupt, ask questions, or add things. With the first one, I'm going to recommend to all of us that we start by using one of Stephen Covey's 7 Habits of Highly Effective People. And for this circumstance with the pandemic that we're entering, that tool is called Begin with the End in Mind. Begin with the end in mind. And the idea here is that at the end of this pandemic, when you reflect back on how you did in your professional and personal lives, what do you want to be able to tell yourself? When you look back at how you were during this, what do you want to be able to tell yourself? Once you've got that idea, then turn that into your intention for how you will be during this time. And it is from deciding how you will be that how you will do emerges. Okay, so think on that. Begin with the end in mind. How do you want to be able to look back on how you did, how you were during this time? Turn that into your intention for how you're going to be in your professional life and your personal life. That will then set up how you're going to do, and it will set up some of the motivation for using the tools we're going to talk about. So in a way, I'm using that one of those habits of highly effective people as a bit of a motivational interviewing type of tool to promote adherence. And I know for your listeners and for PSW, adherence is a big issue. Right? So this is setting up our own adherence to our self-care. Okay? With that, then we move into the shared distress on teams. And the first step is acceptance that we will be distressed and that will be a common experience. And it's understandable. It's predictable. It's not an indictment of us. So when you experience distress, it doesn't mean you aren't a good enough pharmacist. It doesn't mean you're not strong enough. It means you're paying attention as you're working through the experience with the pandemic. So that shared acceptance that we will be distressed. From that, we can then move into practicing kindness and using tools. Very important in doing this with that shared distress is being able to know the symptoms of your stress and distress. What are your responses when you're stressed? And I think of it as if you were to hold up your hand, and each finger is an important life domain that your stress can show up in. So as your listeners are doing it, thumb would be family, because I think of family as central. So that's that critical digit on that hand. Okay, how does your stress and distress show up in your interactions with your family? Are you more irritable? Do you tend to isolate a bit more? Less conversational? More bullet point, if you will, in how you are with people? Next category would be your work, your career. How are you with your teammates? Are you more irritable? Are you more hurried? Is it harder to pay attention, keep your focus? Is it harder to shift from one specific task to another? Next finger would be social. Okay? Unfortunately, the distancing term is incorrect. It should be physical distancing, not social distancing. We should not be social distancing right now. We should be physical distancing. And our social connection, how we do that connection, needs to be different. And the risk is, when under stress, we'll drop it out completely, and we'll confuse that physical distance from our family and friends means we're not staying in touch with them. The next finger over is activities. When under stress, we tend to throw off our daily activities that have supported our well-being. Just when we need them the most, we decide we're too busy to do them, to pause and to go for a walk, or to listen to music, or to watch another episode on a streaming option. Okay, when that's exactly what we need to be careful to protect is the activities. And then the last finger, the physical, how does our stress show up there? Is our sleep disrupted? Okay. So for example, for me, COVID has crept into my dreams. And I don't do dream analysis as a psychologist, but there it is. Right? Disrupted sleep. Are we forgetting to stay hydrated? Have we become more sedentary as we, for many of us, shifting to home, and suddenly we've isolated now in the spare room, and we're not getting up and moving around as much as we did when we were going into our places of employment? So having a sense as you hold that your hand up of the different life domains for how your stress shows up, that helps you then know your signals for being mindful of using the self-care tools. That leads then to practicing kindness with yourself when you notice those symptoms, and practicing it with your team. And we'll get to that neighborhood watch concept in a moment. But practicing kindness means we start as human beings, not as human doings. So when you encounter someone, you don't start with, in the interaction, what are the 3 things we need to get done instantly? You start with acknowledging the person as a person and asking about them. I've been seeing that in our COVID response group at our system level. We start our meetings, and oh my gosh, we've had a lot of those meetings, and we start them by checking in with each other. And we've been much more intentional about that. And the tone it sets for the collaboration is, it's just, it's tough to put to words what that process has been like because of starting with that. Okay? And that kind of tone we can set as we start with our families when we get home from work, starts with our teams when we start the day. The third point on that slide, this is a very practical tool. It's called making repairs. And this is a tool that is critical when we're under stress, because we will make more mistakes in how we interact with each other. We're more vulnerable to making mistakes in our work. Right? And when we know how to use this tool, it makes it easier to address the mistakes. It makes it safer. And safety in a team is critical to patient safety. Here are the 3 steps to making a repair. When you know you've said something that, gosh, just didn't come out right, or you forgot something, or you missed something, and someone else caught it for you, you first own it by saying, yeah, I messed up on that, I missed that, or I was a bit short in how I talked with you. That's owning it. The second step is apologize for it. You know, I'm sorry I was that way. Or I'm sorry I missed that in those medications. Or I'm sorry I didn't get back to that patient as fast as I should have. That's apologizing for it. The third step to making the repair is the amends, what you're going to do, which is saying, thank you for pointing this out. Here's what I want to do to fix this. Here's what I want to do so this doesn't happen again. When we know that we're capable of making repairs and we can do it, it makes approaching the mistakes, the errors, easier. And we're less likely to have our egos get in the way and try to ignore it or react with anger, and more easy for us to be able to own it, apologize for it, and say, here's what we're going to do with it. And for those who are in lead roles in your jobs, to model that to your colleagues and your teams is critical, so that an effective team includes people who can make repairs with each other in real time. A phrase I have that I've been promoting in our system is that exceptional times require exceptional teaming. And this is an exceptional time. And when we need exceptional teaming, egos have no place. Okay? Egos have no place in patient safety, especially when we need exceptional teaming. And when we know we can make repairs with each other, regardless of our title, our degrees, our role, when we can do that, that promotes exceptional teaming. That fourth one for a neighborhood watch, I have to say this is also one of my favorites, and we push this a lot with our residents, which is when you work closely around other people, you get to know when they're doing well and when they aren't. And it's important that we ask those we work with to have our backs, so to speak. So, for example, when I was doing acute emergency inpatient psychiatry, I would turn to my team, particularly when I was on call and had been in the ER at 2 in the morning. And I would tell them, all right, I've had very little sleep. I know I tend to get a little short and irritable. I want to apologize in advance. Please, if I do that with you, let me know. And if you see me missing something, if you see me a bit off my game, I need you to come and tell me. And I promise I will hear that and I will not let my ego get in the way. I can't tell you where I learned to do that, but that made our teaming really effective, and it supported our patients. That concept then is a neighborhood watch, that you're letting each other know, here's when I'm under stress, here's kind of what it will look like. If you see that in me, please come to me and tell me that you notice it, so that it helps me step back and look at what I need to do to take care of it. And I'd like to do the same for you. When a team engages a neighborhood watch, that promotes the exceptional teaming. It reduces risks to patient safety. Before I move into some of the basics of self-care tools, because there are a number there, so I'm wondering if you have any questions or thoughts for listeners from what we just went over.
Wow, I've been taking vigorous notes as you've been talking, because these points are just really hitting home with me, both from a patient care standpoint, but frankly, really also from a personal standpoint as well. And I love this concept of having an exceptional team or exceptional teaming in these exceptional times. And I wondered then, before we move on, if you want to share a little bit about your team and what you're doing to support your team in this both in this exceptional time and frankly prior the BC before COVID, and working through having a highly functioning team that focuses on well-being.
Yeah, I'd be happy to. And actually, before that, I do have a question for Dr. Schulein. And likewise, Sarah, I've been taking vigorous notes too, and hoping to implement many of these into practice and continue post-pandemic, hopefully too. Dr. Schulein, I was wondering, you mentioned the practicing kindness and many of those tools. I know, speaking for myself and many of my colleagues that are frontline managers and leads, it feels like there's extra stress in not only trying to manage that for ourselves, but also for our team members and the patients that we serve. Do you have any tips on how managers and leaders during this stressful time can implement or try and take better care of themselves? Or how do they go about modeling and leading by example for their team?
Yeah, that's where the really talk about having to rise to the occasion when you're in a leadership role, because you still have a right to be a human being, dealing with your own emotions as you support your staff in doing the same. Very basically, what I recommend is, and I hadn't thought that we'd be talking about this, but it's a concept in emotion regulation that I call own it and rate it. And own it means when you're having a feeling, just own it. It's your feeling. So if you're frustrated with a staff person or getting stressed at how a team member is reacting or not reacting, first stop and own the feeling, which means telling yourself, yeah, I'm getting really frustrated, or I'm getting, I'm shocked, or I'm angry, or I'm disappointed. Own that feeling. That I'm not saying share it with the staff member, but own it in yourself, right? So first you do a feelings check on yourself, particularly in that role in as a leader. Second, rate it. Okay, and I'm borrowing from some motivational interviewing here. Rate that from a 1 to 10 for how intense it is. And if it hits a 7, I'm going to be blunt here. Keep your mouth shut. Pull your hands away from your keyboard. Because anything a leader does when their emotion is a 7 or higher is probably going to make things worse. The first thing you do is you step back. You respect the feeling you're having, you identify its intensity, and if it's at that 7 or higher, you need to pause and breathe and step back from the immediate circumstance before you do anything. Then, only when you've done that and that intensity has dropped down to maybe a 3, 4, or 5, then you're in a better spot to engage supportively with that staff person with whatever the issue is or the feeling. And then you're able as a leader to start by acknowledging their feeling first with comments such as, I can see you're really feeling stressed right now, or I can see this is hard right now. And that's where we start. I got to acknowledge I see this as tough, and I know you care, and you're trying to do the best you can. That would be an example of practicing the kindness with this staff person. And only after they've responded to that, then do you start to move into the logical mind of what we will do with the situation. Where I see leaders get in difficulty is when their own emotion is pretty intense, and then that they quickly jump to saying, here's what we got to do to take care of it, without having addressed their own feelings first, and then not having addressed the feelings in the staff person before going to this, what we need to do with it. Email threads, okay, are particularly vulnerable to that happening. That a staff person sends something out that's really emotionally loaded, and the manager or the leader responds quickly to that, that can cascade in a very bad direction. So that's why, I'm thinking of those kinds of steps are practical ideas I'd have for leaders.
Wow, thank you for those great tips. And I think that that's definitely a technique that we can continue to use and even share with our staff members too, because I think when anyone is emotional, the keeping your mouth shut and definitely keeping your hands from the keyboard are all very great and sound advice. I think we've all been on the precipice of an almost bad email having been sent out. So.
Oh, yes.
Yes. Well, I'm glad to hear that, because that does affirm some of the techniques that we've been trying to use at our pharmacy during these times, and I'll share with everyone in hopes that you can find them to be helpful too. And I think the first one is, as Dr. Schulein mentioned, just acknowledging the emotions of the staff and your own emotions too as we lead people through the change. These are definitely uncertain times, and right away, even though we are a closed-door mail-out facility, right away as the pandemic was declared, there was a lot of fear, a lot of anxiety, both about their personal health, their family health, but also about their physical and psychological safety, but their financial safety. What will happen to our work? Will the prescription still be here? So acknowledging that, yes, those things might change and they might be uncertain, but being able to connect through the shared experience to say, we are here to support each other, and we will continue to be here and work through it the best way that we can. And we try to continually to check in with the staff members, and this is where using the everyday employee screening as an opportunity to also check in with their mental and physical well-being is a good time to socially connect, even though we might be practicing physical distancing. The other technique that we found to be particularly valuable now is appreciation. Showing the staff appreciation and then recognizing appreciation in all of the different things that we do, as well as the patient encounters that we've had. Little things with staff appreciation, we've implemented some very simple, but just writing each other kudos notes, and starting from management to staff, but then gradually peer to peer, just to recognize the little kindness that happens for each other throughout the day. And we've used that for interdepartment sharing as well. And then recognizing how incredibly grateful and gracious many of our patients have been in interacting with us, and how appreciative they have been. We've gotten handwritten notes from patients saying, thank you for all you do, please take care of yourself in these difficult times. And sharing that with the staff has been such a positive impact in normal circumstances already, but definitely in these difficult times when you're making a big difference, and being part of the solution. So we try to focus on tokens of appreciation on a daily, if not weekly basis, and try to highlight the good things.
Wonderful. Just right on for the circumstance. Nice work.
Thank you.
And that's so neat to hear that insight into how you're helping your team through this. I applaud those efforts. I see so many great things that are happening around the state, and oftentimes people are sharing those on social media, or we'll get a note sent our way about what's working and what how a organization has navigated through a challenge. And that's pretty, we'll talk later about inspiration, but it's pretty inspiring to see that come through and helping teams function exceptionally. The other aspect of teams that certainly are very important, and I think present both challenge and opportunity in this time, is the role of learners. And Dr. Schulein, I know you've spent a lot of time supporting well-being within learners, and I know that's a topic Zin's very passionate about. I wonder if the two of you could comment about the role of learners and their well-being, and potentially that modeling piece, both from a residency program standpoint, but also from a student pharmacist standpoint. We certainly see that as an important topic right now.
Zin, I think I'll defer to you to start with.
Sure, thank you. Yeah, currently we are not engaging with any learners during the pandemic. However, I think some of the techniques that I've emphasized with learners will carry through. The first one might not be what typically comes to mind, but it is actually the last point on Dr. Schulein's slide. Is I start with learners by actually asking them about self-care. And when learners first come to our site, I like to sit down with them, and instead of doing an orientation for our site, I like to ask them about their personal and professional aspirations and what they're looking to gain out of the experience. And then I ask them about what tactics and techniques they utilize to accomplish their goals. And so in getting to know what expectations they have for our site, I also learn a little bit about them as a person and what their habits are as a working professional. In knowing that helps us complement our learning site tactics and techniques to either help challenge them and develop areas of gaps, or help support their areas of strength. And so we definitely have clinical goals and certain professional goals that needs to be accomplished on site, but I like to actually start with the individual first to learn better about their coping mechanisms, like even hobbies or what they like to do for fun, so that to make sure while they're being overwhelmed by the multiple academic demands, we are making sure that they're still developing as a person.
I just listening, and I have a smile on my face as you describe that, Zin. For me, that conveys a respect, meaning that yes, you're a student. However, you're also coming in with tools in your toolkit. You have tools that you already have, or you wouldn't have made it this far with all your schooling and the stress of that. You wouldn't have made it this far in life. What tools do you already have? And let's first notice those as you then apply to this new circumstance as a learner in this new setting. That's a nice combination of respect and reminding people that they have tools. That parallels, I think, in some ways, how we approach this pandemic, that we all have tools, but under the distress, the intense emotion, we might forget that we have those tools. And a part of stepping back is to be able to step back and go, wait a minute, is there anything remotely similar in my professional experience or my personal experience that I can draw on to build how I'm going to do through this pandemic? And I'm reminded of that for how you approach that with your learners.
Dr. Schulein, one of the things I think some of our listeners might relate to is the fact that in their learning and their training, whether it's residency training or their early career being a student pharmacist, they may have been hugely challenged, and expectations were high of them, and work more was rewarded with, you must be a better professional, and the amount of hours you spend at work or working on projects is directly related to how good you are as a pharmacist or a clinician. We're definitely seeing a shift more towards focusing on well-being, and that maybe those equations we used for learners previously are not the right equations now. But I get the sense sometimes that those that were trained in that culture may not understand this shift and may think, people just need to toughen up and be, buck up, and I got through this and it's just a rite of passage. Could you comment on that perspective and that culture and how we shift things to really recognize whole clinicians?
Sure, and I'll apologize if I get a little long-winded on this. Back in my day, I was trained in that culture, and I distinctly remember working at on internship at the pediatric medical center, where I was told as a psychology intern that if I wanted to become a member of the medical staff, you had to become married to the hospital. And I remembered not liking that phrase. I didn't want to be married to the hospital. I was already married. And I wasn't going to practice polygamy. And that, to me, reflected a time where in the equation, it really was only one variable, which was your professional self. You had to be married to the medical center. When you look at the term, where does the term resident come from? It comes from where were those learners housed? They lived in the hospital. When you look back a century ago for where we started to evolve that whole term of resident and residency. Fortunately, we're understanding that the equation involves another variable, and it's our personal self. And even more importantly, if you think of it as a fraction, the numerator, the top variable, is the professional self. The denominator, the lower variable, is the personal self. And if that personal self cracks or crumbles, everything above it's going to fall as well. Okay. Another way of thinking of it is the foundation to a house. That then is a way to justify taking care of ourselves, even for people from a previous generation in training or previous culture, that we need to be, superheroes and disregard our personal selves. That's a way of addressing that. However, there will be some senior faculty who have a hard time with that shift, and that's where it's important in a team that those other team members have others they can go to, so that they don't take on that older perspective and then start to judge themselves harshly.
And I would like to just add to that too. I think this is where preceptors leading by example is particularly valuable in setting that culture. Give me an example of emails. If you are sending your students emails at 10, 11 p.m. at night, that's setting up a expectation that they should also be responding and reading emails at 10 and 11 o'clock at night. So try really hard not to do that for our learners. And then likewise, if you're getting emails at 10 or 11 o'clock at night, as a preceptor, we try to address it to say, hey, how's your workload? Are you working on things that late at night? Is there something that we need to talk about to help be more efficient or take things away if we're giving you too much?
Nice practical examples of leading on the well-being. Nice.
Maybe that's a good transition to the concepts that we could circle back on related to the basics of self-care. And in particular, I think in this COVID-19 pandemic, the 24/7 nature of the work that we're seeing, that intensity that we talked about before, I think the basics of self-care tend to, as we've talked about, get forgotten. So raising those up, I think this will be a good chance to do that. So maybe we could make that shift, Dr. Schulein, to those basic concepts.
Sure. And they are basic, and we need to return to the basics in a time like this. So when I think of basics, it means starting with our physical health. Are we cheating our sleep to be constantly in touch with our colleagues, midnight emails, taking call beyond our call time, being at work when we're not supposed to be? Are we cheating our sleep? Second is, are we cheating our nutrition? Are we suddenly too busy to eat? And so what we switch to is carbo snacks rather than things that are balanced nutrition. Are we cheating our hydration? Boy, and there we know even slight dehydration has neurological impediment for us. That's a big one we push with our residents. They have to be hydrating through the day as a patient's safety, not just a self-care. Next, physical is moving. So for us, it's you don't use elevators. You use stairs. Anything that gets your body moving will be a stress tolerance tool right now, a self-care tool. So those are your basic tools for self-care. Another at a physical level is getting outside. And for those of us who are fortunate that we're not living in high density areas, we have the opportunity to step outside safely, and we need to be very deliberate in doing that. Those are some of the very basic self-care tools where you hear it and you go, well, sure, of course, yet we may not actually do them. Others for self-care are taking the breaks we need to pause and breathe, like my infectious disease specialist recommended for us. Listening to music, deliberately having time with family or friends through social media platforms, video, watching things that have nothing to do with our job or the virus. A tool that we're encouraging our staff to add to their phones is one that we've used clinically, and now as a stress tolerance tool, I'm going to recommend it, and it's called the Virtual Hope Box. And it's an app available both on both platforms. It's free. It uses some evidence-based tools, but it's very quick to engage to give you breaks. So I encourage you to look it up, Virtual Hope Box. It takes less a minute to install, a couple minutes to add photos, and you immediately have a basic tool literally in your pocket to help you do some of the basics of stress tolerance.
Sounds like I've got a new app to download, for sure. The other tool that has been made available during this time for healthcare providers, which actually was already available for pharmacists if they had a membership to ASHP, is Headspace, which is a meditation, sort of focuses on that breath piece. So that's something that I really need to be intentional about, and is clearly coming through as a theme of this session today, is really taking that, really truly that basic of taking a breath and knowing when to take breaths and breaks.
Yes, and I'm glad you mentioned Headspace. That's one from our behavioral health specialist that we also recommend.
I've been so impressed with, I have a 7-year-old daughter, and I've been so impressed with how now I really feel like curriculum for kids include a lot more focus on mental health and being intentional about that breath. They use tools at school for kids, and not just kids that have behavioral problems, but all kids. That is a focus. And I find that the activities that she's doing from a homeschool standpoint for that are actually so applicable to us as adults. So I've taken some tips from those programs as well. I'm sure there's a number of other ones that we're not talking about today, but we have so much access to those things truly right in our pocket.
That I really appreciate you saying that, Sarah, because what we're learning in education is that our learners learn better when they're less stressed. Stress disrupts learning. And those practical tools for the grade school student, the pharmacy resident, and anybody in between or in other fields, there is stress disrupts the effectiveness of our learning. So these tools support that. And when you think about it, we all have a lot of learning to do as we encounter the pandemic. So managing our stress helps our learning be more effective.
I wanted to now transition just a little bit to talk about some other settings where pharmacists are practicing and providing patient care. We certainly have so many inspiring stories of clinicians at the front lines, in pharmacies, in health systems, in clinics, working every day, really exposed to the pandemic, exposing their families to the pandemic. We also now you mentioned the physical distancing that's occurring. All of us we're working in maybe non-traditional settings are now shifting to working remotely. I've found that to be the case for our PSW staff, as we're all now working remotely. We've had some experience for a very short period of time working remotely when our offices were under construction a year ago, but now we're working remotely for a longer period of time, and the intensity of the work is no less. In fact, it's much greater. In fact, we're running the whole PSW educational conference virtually yesterday and today from remote locations, and the challenges that brings, the disconnection that it brings, the mental health aspects that come with for some people working remotely. So that's been an area that I think a lot of us are needing to navigate through. And one of the points both of you mentioned earlier in the discussion was putting that emotional self first and checking in, and not just letting the work be the focus of the check-ins. I think that's something I'm going to take away and make sure we're doing as a team for the PSW staff team. So there are a lot of tools and resources available. Again, drinking out of a fire hose, they're just coming at us from a lot of different directions, but there are certainly aspects of well-being that need to be focused on when you're working from home. I find the integration of personal and professional when you're at home to be a challenge. Both my husband and I are working from home, and our daughter is being homeschooled from home, and trying to make sure we're providing a great environment for her while also being on calls left and right throughout the day has been a real challenge. And I know a lot of other parents are struggling with that as well. So I just thought I'd mention that, and I don't know if either of you have any comments related to that, but I know a lot of our members are now working remotely. The other factor that comes into play when we're working remotely is the patient care that may be being done remotely. And Dr. Schulein, before we joined today's call, you talked a little bit about telehealth and the provision of care to patients from a remote location. I know a lot of our members are doing that right now, and it's a different environment for patient care. So I don't know if, again, that is something that you have any comments on.
I do, and this is a tool that I've been applying to myself especially, and it comes out of other traditions and including mindfulness, stress reduction, which is a beginner's mind, because I was doing 0% telehealth before COVID, and I'm now doing 100% telehealth, and I'm a beginner. And so as I introduce telehealth with each of my patients in that first telehealth visit, I introduce the concept of being a beginner or a rookie, and that allows permission for making mistakes and for learning as we go in making that encounter as effective as we can. That makes it easier for me to go ahead and make repairs when I realize, oops, I missed something, or we had some type of disruption. So there's from my toolkit, that concept of beginner's mind, using that as I adjust to using telehealth, and also out of kindness to my patients, explaining that we're going to apply that same perspective to how they engage back with me in the interaction.
And Sarah, I would also add, as a fellow now homeschooling parent, I think we should also be kind to ourselves. I think it's unrealistic to expect the same level of productivity while working at home, plus trying to institute an academic schedule for your home learner. And it's almost impossible to do all of that within your quote unquote 8-hour workday. So I think two things that helped. One is to be kind for yourself and have realistic expectations. I think on average, homeschooling will not be a full 7 to 8 hour workday like actual school is. And remember, kids at school get recess, and likewise at work you get breaks too. So you have to accept that you're not working from home. You're working from home during a crisis. And the second technique that I found to be helpful is to have boundaries, like know when your workday ends, because when you're at home, your physical environment isn't really changing. And so the boundaries, the borders can really merge together. So if you're fortunate to have uninterrupted work time during the day, still end your workday at a reasonable time so you can devote the other time to self-care and being together with your family.
Such great point.
One of the tools I'll suggest, and I attended a webinar from the Institute for Healthcare Improvement last Friday regarding lessons learned so far, and one of them was an exit strategy when you're leaving work. And it came from the National Health Service in the UK as they're dealing with COVID, whereas their staff are leaving their shift, their whatever workspace they're in. They have a poster up with about 5 or 6 things they want the staff person to go through as they're leaving work. And while that was set up for inpatient settings, it can apply when we're leaving a work, so to speak, from home. And I think you can find it on the IHI from last Friday's webinar, but the key points were, before you leave work, take a moment to think about the workday. Acknowledge one thing that was difficult, and then let it go. Be proud of the care you gave today. Consider 3 things that went well today. Check on a colleague before you leave. Remember you're not alone. And then switch your attention to home and family as you then leave that workspace. And we found that in our COVID response team very useful, and we're taking that, adapting it, and that's going up around our organization to help our staff shift out of work, whether they're leaving work in real space or virtual from home-based.
I love that. The other tools that I wanted to share with our listeners today are a couple from national organizations, pharmacy organizations. Many of our members have already taken the American Pharmacists Association, or APHA, Wellbeing Index. This is a partnership between APHA and the Mayo Clinic. The Wellbeing Index is designed to evaluate fatigue, depression, burnout, stress, mental and physical quality of life. It is anonymous, and you get your results. Has been interesting to see the de-identified collated results for different parts of the country, different states. You can take this index really as many times as you want, and certainly right now responses to this index might be a little different than they would have been a couple of months ago. So we encourage our members to consider how this tool might be helpful, and may also be used with learners as well. And then ASHP has developed a really great website on well-being, and a lot of the focus here is on those basics of self-care. There's some information that we think members may find helpful with the ASHP Wellbeing page, and they have podcasts and other materials as well. Again, something for you and for your learners. Right now, with so much going on, it's again hard to focus on taking time for doing some of these things, but as we heard earlier in our discussion, focusing on taking a breath and those basics can really help disrupt that stress to allow you to be more focused on the care of your patient. And then certainly there's a huge amount of stress that our patient populations are dealing with, our families are dealing with. The CDC does have some really good information related to stress and coping during this time of pandemic. And I'd encourage individuals to check out this information and refer others to really great material there. And then lastly, in terms of resources that we haven't yet discussed on today's call, I wanted to share, there's this really great cartoon or graphic from NPR that I found to be really helpful for my daughter, but also I think just depending upon the age of your kids can be helpful, and really putting the coronavirus pandemic in the context of how do you talk with your kids about it. And as I mentioned earlier, some of the tools that are designed for kids I think help adults too. And so I've tried to share some of these through social media and with other mom friends. So I'd encourage you, if you haven't seen this NPR comic, to check it out. There's a number of other great resources for talking with kids about COVID-19 that are available from other groups as well, and we've linked some of those resources on the PSW COVID-19 website. So shifting to sort of move towards wrapping up our discussion today, I wanted to provide Dr. Schulein and Zinn the opportunity to share a little bit about what's inspiring to you right now and what inspires you about this topic of well-being, what inspires you about how we're navigating through this public health crisis, and really turn it over maybe to Dr. Schulein first.
I think for me, it's this is a, I used that phrase earlier, that this is a once in a lifetime shared distress event. And one of my inspirations is seeing my colleagues, ones I know and ones in my organization I knew of but hadn't worked with before, and suddenly we're working together intensely. We all are getting that this is a once in a lifetime shared distress event, and we're all rising to the occasion to bring what we can to support our systems in taking care of our patients. And it's inspiring to see that in so many of my colleagues and to get to participate in that. That to me, I was talking about with someone, these last 3 weeks have been some of the most intensely alive, charged times in my career because of that.
And I would echo those comments too. I think it's really inspiring to see how everyone has pulled together, and definitely our colleagues in our own healthcare system and systems across the state, across the country, seeing, news of practitioners coming out of retirement to join the front lines. All of those stories kind of validate again why we are essential workers and why we're here to help continue to provide the care for the communities that we serve. I'm also inspired on that personal note when you mention kids, and we know in looking at our children and how resilient they are, and while it is an overwhelming situation and their lives have been upended, uprooted with school ending, they don't get to see their friends. There's really not a clear reason or visible enemy that they can see and why all their activities have been terminated. They remain very positive, and so I'm inspired and amazed at the resilience that the children and really a lot of our patients in the community has demonstrated. So seeing the positive responses really inspire me to keep on doing what we do, and I firmly believe that pharmacy will have a crucial role in this pandemic and continue to, in face of all of the shortages that we're already facing, and helping patients navigate and helping our colleagues manage and navigate the changing drug shortage supply scene.
And you really hit the nail on the head in terms of what we're seeing from the pharmacy community. And I just want to thank our members and pharmacists, pharmacy technicians, student pharmacists, and other healthcare professionals for all they're doing to serve patients, whether that's regardless of what setting that's in, or whether they're doing that from the front lines or from their home, supporting those front lines. We really thank you from the bottom of our hearts, and we have this shared distress event that we will get through, and I'm humbled by what we're seeing from the healthcare community. So that wraps up the questions that I had for our guests on today's call. I really can't thank you enough for adapting to this new presentation format. I want to provide both of you the opportunity to share any closing thoughts or resources that you might like to convey to our listeners. So, Dr. Schulein, any closing thoughts?
Thank you for the opportunity to talk with both of you today and to share with your listeners your profession. Second, what you do matters. It really matters. Third, be kind to yourself and each other. Those, I think, were the things that I'm looking at, what would be bedrock. And finally, make sure you know how you want to be as you're busy with all the doing. And I wish you all the best as we work together through this.
I just wanted to thank Dr. Schulein again for taking the time to share his expertise and for all of the work that he's been doing, helping support all of us here in the health system in better taking care of ourselves and taking care of our patients. And I just want to thank everyone else for doing that and doing all of the things to keep themselves healthy, keep our communities healthy, and take care.
Yeah, thank you so much, and we appreciate your time.